Well, the U.S. has registered almost 100,000 coronavirus cases in a 24-hour period. That's a new record in the pandemic there. Infections have been surging across the country, but as a percentage of the population, the Midwest is currently hardest hit. And in addition to rising cases, hospitalizations are also soaring. North Dakota says it has only 6 free intensive care beds left in the entire state. More than 230,000 people have now died in the U.S. after catching the virus. Well, for more, let's bring in Peter Chin Hong from the University of San Francisco. He's a medical educator who specializes in treating infectious diseases. Thanks for being with us. Could going to the ballot boxes, in other words, voting in person, do you think that could have accelerated infections in the U.S.?
It certainly could have, Terry. Masks weren't mandated in voting facilities in the United States during the season. In fact, even if your state has a mask mandate, the federal law didn't permit or didn't mandate or enforce mask wearing at these sites. I'm also concerned that the activities around election time, the buses of supporters, particularly from President Trump, they're not wearing masks, they're in an enclosed space, they're riding up and down. These all promote potential super spreading events.
Well, talking about events, economists from Stanford University have calculated that tens of thousands of people may have been infected with the coronavirus during Donald Trump's big election rallies. We just saw some footage from there. Is that plausible?
It's certainly plausible. The exact numbers are a little bit hard to state. In the Stanford University projections, they didn't look at actual contact tracer numbers, but used projections of like states with similar epidemiology and very similar communities where these rallies didn't occur. Compare those sites, and then that's how you get to the tens of thousands of excess cases. It's definitely plausible. People are not wearing masks in these rallies. They're huddled close together. They're shouting. They're screaming. There's a lot of emotions. And these are the states where there's a lot of coronavirus happening right now. So your pre-test probability of getting an infection in these communities is actually higher.
Now, no winner has been declared yet in this election, but if Biden does become president, what, if anything, do you think will change in how the federal government in the U.S. deals with the pandemic?
Well, I'm afraid, Terry, that the cat is already out of the bag in terms of the rapid rise and the acceleration of infections right now in the wintertime. If Biden wins, he won't be in office until January. And again, by then, who knows how many more hundreds of thousands of infections we'd have in the United States. I think the first thing that Biden would probably do, however, is he's talked about having a national mask mandate, and definitely we'll wait for a national strategy. Those two very simple things for a country haven't really been what we've seen in the last few months in the United States. Every state was fending for itself, except that states weren't able to close themselves off. The borders were porous, and, virus can go from one area to the other, depending on, regardless of what was enforced in one state.
Mr. Chin Hong, thank you very much for talking with us. That was Peter Chin Hong, a medical educator from the University of San Francisco.
Thank you.
And here's some of the other latest developments in the pandemic. Germany has likewise set a new record for new infections in the country. Almost 20,000 positive cases were registered in the last 24 hours. In England, a second nationwide lockdown has come into effect. Tough restrictions on social contacts are in place, and all non-essential businesses will be closed for the next 4 weeks. Denmark, meanwhile, is set to cull all the country's farmed minks after a mutation of the coronavirus was found in the animals.